Hello everyone, I'm Darlene Young from Arlington, an outreach coordinator here at CAT TV, and I'd like to welcome you to another segment of Mindful Health Alternatives. And it appears here monthly on CAT TV on Channel 15, and we hope that you've enjoyed what you've seen previous to this, and I'm sure you're going to love this episode. The goal of the series, as many of you remember, is to introduce you to a less stressful way of life or to a less stressful lifestyle through several different methods. And always remind you that before you start anything, if you decided to do acupuncture or anything like that, you would always check with your family doctor first to make sure that, you know, everything's okay and you don't have any other problems that would prohibit you from taking on the program of acupuncture or other modalities. With me today is our guest, Jody Lawless Corrado, and Jody is a physical therapist that I've known for a few years, and she specializes in several different physical therapy techniques and in wellness services such as massage, craniosacral therapy, and zero balancing, just to name a few. And Jody, I'd like to welcome you to CAT TV and to the Mindful Health Alternatives. I'm so glad that you're here.
Oh, me too.
Great. And she brought Mr. Bones with her today because she's going to be referring to him and to the charts that she has to her immediate right. And for practical purposes today, we're not going to use the table and show you what the massage and the craniosacral look like. We'll do that on another program. So again, welcome, and I'm going to turn the show over to Jody. Take it away.
I've been a physical therapist since 1990, graduated from Russell Sage, and when I was at Russell Sage, I realized that I loved manual therapies, and I'd already been teaching exercise since 1984. So I've been involved with fitness for 31 years.
Oh, very good.
And I've been a physical therapist for 25 years. But I realized that the two opposite ends of the spectrums were what really attracted me, because I really felt that if I could use manual therapies to correct the structure of the body and then use exercise to maintain the correction, then it just was the best possible combination.
Great.
So I even extended that into offering personal training. I'm certified through the American College of Sports Medicine. And I also I help out Sandy Stevens over at the Mill, where our office is, and we do small personal training group fitness with Bali X. That's one of the things we do.
Sort of like dancing.
It's amazing. It's dancing from Bollywood, from India.
Okay.
And it's westernized a little bit so that, you know, even we can do it. So,
well, maybe we'll get you and Sandy to come and do a segment on a program for that. It sounds like fun.
oh, it's so much fun.
Good.
It's so much fun. But I found over the years that that is the best approach, to correct things, correct structure so you can correct the function, and then use exercise to make sure that it is sustainable and make sure that people get healthier and stay that way.
Okay.
So what that means is that once they were done with physical therapy, they very often wanted to continue.
Okay.
Because life comes along and you might trip, or you might just misstep, and you might need manual therapy correction, but it's not really something you would go to a doctor or physical therapist for. It's just something where you just maybe you just feel a little bit sore and you just want to have it massaged out, or you just want to have some craniosacral to relax the inner structures and restore rhythm. And then maybe just have an idea of what personal training, what exercise might come along and help you out with that.
Okay.
So that's where the wellness part of my practice came along. And I've been doing that for a while.
Very good. Now, like today we said we were going to talk about zero balancing and craniosacral therapy. Can you explain each one of those, and then we can talk about each one of those? Okay. You want to start with craniosacral?
Sure. Craniosacral is based on the foundation, the belief that the nervous system has its own rhythm. And in the Far East and in Eastern medicines, it's always been acknowledged that the cranial bones actually move. And if you look at the structure, we'll be looking at the structure of the sutures, which are the joints of the skull. If you look at the way they move, they interdigitate and they allow for expansion and things like that. They're not necessarily fused in healthy, normal individuals. So craniosacral was something that has been dabbled with by various physicians, not so much in the West, but a little bit more in the East. And the doctor that came up with a solid approach toward it was John Upletcher. And he wrote the first books in the early 1980s, but he based some of his findings on what Dr. Sutherland did in the early 20th century.
Okay. Now, when you do craniosacral, I mean, is it because a person has a headache or neck ache or?
Very often.
Really?
Very often. And sometimes people come to me just because they're anxious or, you know, they've had some traumatic emotional events and they want to relax.
Okay.
I mean, there's just so many wonderful ways that it can help you.
Okay, and like being the skull and the beginning of the vertebral bodies or the spinal cord, it probably affects other parts of your body as well.
Intimately.
Okay.
Intimately it does. When you look at a live individual and you can actually see the way the brain fits into the skull, it has several layers of connective tissues that are very intimately invested into the curves and the shape of the spine and the skull. So those wonderful connective tissues, they serve to protect the brain, to protect the spinal column and protect the nerves as they start to emerge from the actual spinal column itself. But when you consider that those connective tissues also, the outside one, the dura mater, also is contiguous with the skull, and parts of the spine, the upper cervical spine and the sacrum, if you can use the bones as very gentle levers, you can actually correct any restrictions from, say, whiplash, or someone who has chronic headaches because things are just kind of jammed up in there. You can release that and take the pressure off. The blood can flow better because now things aren't tight. Even lymphatic flow can improve. And of course the nervous system. The nervous system is healthier.
Wow. Because a long time ago, I had the opportunity to have craniosacral, and I can remember lying on the table and the therapist just like cradling my head, and and her hands were just there, and all of a sudden it just felt like I was moving, but and it was just like everything was unwinding, and it just felt kind of strange, but it felt really good afterwards,
Absolutely.
So is that kind of what happens?
It is. And it's different for everybody, and it's different for every treatment. So when people come to me or to any craniosacral practitioner, the first thing we always do is listen. And there are listening stations. There are 5 listening stations of the body where you can detect what we call squar. It's SQUAR.
Okay.
And that's just the acronym for listening to the symmetry of the rhythm, the quality of the rhythm, the amplitude, and the rate.
Okay.
And that way, when you're listening bilaterally, you can start at the heels and listen. And if one side of the body is just moving this way, and it's not supposed to be, then you say, "Ooh, there's something going on that person's left side," and then you just continue listening at the different stations until you can home in to where the rhythm's been disrupted.
Okay.
And that's where you need to focus the gentle treatment.
Okay. So the patient is like lying on the table, per se, in their clothes, and a lot of people think that if they go, they have to get into it like a Johnny or something like that, but they wear the regular clothes and just lie on the table. And as Jody said, you would start at the toes or start at the feet, or would you start at the head and work down?
Well, you could basically start any old way classically, and it's something that I do. Classically, I like to start at the feet because A, that's how I was trained, but B, that's how we interact with the planet. We always, the feet have a lot to say. I also do reflexology, and even in zero balancing, we start at the feet after we do the assessment, and we work up because that's how you interact with gravity and momentum.
Right, and the
things
feet
like that.
basically are the roots, and they, with the chakras and stuff, they go down into the earth, and they're the root of the person.
Yeah, there are interface with the planet, absolutely.
Yeah,
Yeah.
good. So would you like to tell us a little bit about zero balancing too?
Sure.
Okay.
Zero balancing can be very similar to craniosacral in the aspect that they're both looking to balance things. Zero balancing is working primarily with energy fields.
Okay.
And it was originally discovered in an aha sort of epiphany moment by a chiropractor.
Really?
And he was sitting in darshan, which is, he was sitting in meditation with a yogi teacher and his mentor. And he just was struck with this awareness that the bones are almost like a conductive system, because the bones are made out of crystal and mineral matrices.
Okay.
All right. And we've known for quite a long time that if you take a crystal or mineral structure and you impart into it a stress or a force, or sometimes even an electrical field, energy is released.
Okay.
And this was originally used for ultrasounds. Diagnostic ultrasound started this way, and therapeutic ultrasound for physical therapy started that way.
Really?
They would take a crystal and they would put a certain amplitude electrical charge into the crystal, and then ultrasonic wavelengths can come
wow.
out. Nowadays they use microchips, but that's called the piezoelectric effect.
Okay.
So zero balancing is based in that scientific, well-known fact that if you take a crystalline mineral structure and you impart a certain degree, a certain amplitude stimulus into it, you can release energy and ultimately help balance the energy systems of the body.
Now, zero balancing, again, the patient lies on the table, fully clothed, and you work on them. Somewheres in my research it said 30 minutes. Is it always 30 minutes, or can it be longer?
It could be longer, but they have a very very structured protocol, and we really like to stay to that protocol as much as we can. And each stimulus really isn't much longer than, we like to say, between 4 to 6 seconds.
Really?
Where you get in there and you find the area that's just, it's stuck. There could be a bony, or just a feeling of not so much being stuck, but being too soft or just not right.
Okay.
And then you just impart a little bit of pressure, and you hold a stillness there, and then you start to feel pulsing or softening of it around, and then as soon as you feel that, you wait for the body to correct itself, and then you move on.
Wow.
Yeah.
This is really fascinating, and I mean, it just seems really neat that you can work with someone and get the flowing back into the body and stuff. And it's really good to have the alternative medicines, because I think a lot more people are learning about it. And even some of the MDs, you'll read in their biographies that's published, so people can get to know them if they're a new practitioner, that they believe in alternative medicine and integrative therapies as well. And I know some of the oncologists also do it for cancer patients. So, it's really good. So, why don't you tell us a little bit more about the craniosacral? Like, have you had a lot of patients that have come in like with TMJ problems, or is it just or is it just like my shoulders are killing me, or my hip is killing me? Like, what is the most common thing that you see?
Oh, my goodness, everything.
Yeah.
And first people do go to their doctors, or if they come to me and they tell me something that makes me suspect that there might be some underlying problems that are inappropriate. The only real inappropriate things or contraindications for craniosacral are an aneurysm of some sort, a recent stroke, because we're playing with the meninges, we're playing with the pressure gradient in the body. And of course, any unstable things like maybe a recent fracture. You wouldn't want to get in and mess around with a recent fracture that hasn't healed. So if somebody comes to me and they present with something that sounds like they really need to be checked out by a doctor first, I'll say, just go have yourself checked out. But if they come and say, I just want to relax. And I'll say, okay, you can they go through their medical history, and that helps. And then very often I have some of my more long-term clients will lie down on the table and say, "You tell me."
Oh, okay.
And so I can listen to the different rhythms of the body and say, "Oh, wow, your left SI," and I can see you really got something going on in the upper cervical spine here, and you've knocked off the rhythm, TMJ rhythm perhaps, and things like that. And then we'll address them in the stages according to which is the most serious thing.
Okay.
And the reason it's important to listen to the whole body is because the entire body is enveloped and supported and held, embraced in a fascial structure. And some people described the connective tissue inside the body as being a web. Some people have described it as tubes within tubes within tubes. Some people say it's like having envelopes, and that's appropriate. I mean, your nerves can be tubes within tubes because you have 3 meninges in the brain and the spinal cord, so they can be three layers of tubes. And your organs can be enveloped in these wonderful embracing sacs to hold them in place. Like there's, there the organs of the intestines, the lungs, every part of your body is embraced and supported with connective tissue, which means you can literally get a bonk at the top of your head here, have it throw off the connective tissues up here, so then you have to adapt to it. And over here you might develop just a little bit of tightness over here, and you have to adapt to that, so then it moves down into the ribs, and then you also start to get a tightness in the lower back, and so on. So when you think about how every part of the body is communicating and working in symmetry with every other part of the body, when people come in, there's a lot to look at. There's a lot that can be done.
Sure. Now, traditionally, when a patient comes in to see you, and they want to relax, or they've never been seen by you, you say you take their history, and like you do like a brief, what do I want to say, overview of their physicality, and basically how long does the initial, like assessing the patient, how long does that usually take?
I'm never shorter than an hour, ever. And I generally like, as a gift to my patients, I like to give, or my clients, I like to give them an extra 15 minutes. So if someone comes to me, and even if they haven't seen me before, they're guaranteed to be in my office interacting with me at 90 minutes. Coming in the door, checking them over, taking a look at them, listening to their bodies, and treating them, getting them off the table slowly, because your blood pressure adjusts down.
Sure.
So getting them off the table slowly, giving them probably a couple little homework exercises to do just to maintain it, educating them about what's happened and how they can benefit themselves, and then rescheduling and sending them on their way.
Now, it's true also that you remind them to drink lots of water after a session?
Tons of water.
Yeah.
And more so, even if they're water drinkers, more so than they normally would drink. Because when you think about the fascia relies on water. Your intestinal system, all the major chemical reactions in the body have water involved to some extent. So we want to make sure the lymphatics are well hydrated in everything else, head to toe.
Very good. What else can you tell us about? I'm just going to not ask you a couple of questions here. I'm going to just turn it over to you and let you do your craniosacral and your zero balancing. So take it away.
Okay. Well, craniosacral is an extraordinarily gentle treatment. When we approach and we listen to the body, we want to make sure that we're not disturbing what's going on. So we usually try to just be observers at first. So if I take the heels while someone's lying down on my table, if I take the heels and listen, I won't be applying more than 0 to 5 grams of pressure. I'll just be cradling the structures and listening to what they have to say. And when I say listening, what I mean is that if you imagine a perfectly still pond at sunrise and somebody drops a pebble, there's a rippling effect that goes out. Well, when you have an injury to your body, or a disease, or you have a cold or an infection, you have a rippling effect. And if the injury isn't completely healed and, I guess, corrected, the rippling doesn't go away.
Okay.
So when we listen to it in the craniosacral, we call it arcing, because if something is moving this way, it means they're arcing, the ripplings are coming from over there because it's moving away from it.
Okay.
And so then we just zero in and we get closer and closer, and you can listen from top to bottom, like underneath the back and on the abdomen, you can listen. And if the arcing is stronger up here, it means that it's coming from down here, and vice versa.
Okay.
So if I feel a really strong arcing, it's probably something closer to the surface. And that's why craniosacral is unique to me, because even if I can't tell what has caused that arcing, I at least know the area where we have to focus. And when you apply 0 to 5 grams, just in the beginning of the treatments, and sometimes you need to exert more. Some people need a little bit more pressure, up to 10, 15 grams. Well, putting it in perspective, 5 grams is the weight of a nickel.
Okay.
So being able to lift a nickel with your finger is how little pressure we're using.
Okay. Now, with the arcing, and you're saying like the ripple effect, would a person feel it as like a muscle spasm or an ache, or wouldn't they feel it at all?
Yes.
Yes.
To all of that.
Okay.
Because very often the pain can stay there because the structure can be so out of alignment, or there could be scarring in the muscle from an injury. There could be the ligaments could have torn, and when they heal, there's a little bit of clumping in the protein, the collagen. Those sort of things can become aggravating enough to become pain. So the person might be very aware of, oh yeah, I've always ever since that whiplash injury, I've always had pain up here. And somebody might say, oh no, I really don't have pain. I just want to relax. But as you go up the body, you find it's stored.
Yeah, and you're starting to unlock things. Okay,
Yeah.
good. Okay.
Yep.
So what else happens? I mean, after the arcing and the ripple effect, what goes on then?
Well, as you go up the body and you ascertain where your focus is going to be, and together with the patient's goals for treatment, sometimes I tell the patient, okay, this is what I found, and I know you really wanted to work on A, but it looks like in order to get there, we have to work on B, and I talk to the patient about that. So after we have a little conference, then what I do is I go through, classically is considered the 10-step protocol. And if you want to come over here, I can show you what the 10-step protocol is.
Okay. I'm just going to sit right here and watch you, if that's okay?
Alrighty, I'm going to move Mr. Bones out of the way.
Okay.
This was developed by John Upledger
Okay.
in the 80s because he was doing wonderful work with autistic children. And it's right over here, the 10-step protocol.
Okay.
And autistic children classically don't like to be touched.
Really?
And yeah, in many levels.
Okay.
So what he did was he decided to train some social workers, some counselors, psychotherapists who wanted to be able to get in there and help these children as much as they could.
Okay.
So he came up with a protocol that would cover all the bases. And the first part of the 10-step is inducing what we call a still point. So in order to describe a still point, I have to take a step back and explain that craniosacral structures in the body have their own natural rhythm, just like the way your heart does and the way your breathing does.
Okay.
The craniosacral rhythm tends to be slower. You get maybe 6 to 8 per minute, depending on your own personal rhythm. And what happens is inside the skull, there are spaces called ventricles.
Okay.
And the ventricles store cerebrospinal fluid.
Okay.
And it's actually manufactured in these little tiny things called choroid plexes, which are wonderfully intricate and web-like structures that take fluid from the blood and they turn it into the cerebrospinal fluid, they filter it out. And then once it gets into the ventricles, it's pumped in a way. And when it's pumped, it expands out and in through the brain and down through the spinal column.
Oh, okay.
Okay, so because there's this tiny, it's quite subtle. It's in millimeters only, but it's constant. Because there's this buildup of pressure, the sutures of the skull allow movement, and the rest of the body responds and echoes that movement. So, as the fluid is manufactured, there's a swelling, and the body expands, and everything rotates outward and expands. Then it's partially reabsorbed.
Okay.
And then you come back in, you internally rotate, and the body kind of closes down a little bit. When you're expanding outward and moving outward, we call that flexion, craniosacral flexion. And as it's partially reabsorbed, we call it craniosacral extension.
Okay. So it's almost like ebbing, like the moon. It, like it has its cycles, but it's also like flowing and it's waxing and waning almost.
Absolutely,
Okay.
absolutely. So we know that the cerebrospinal fluid is being manufactured. We know that it has to get down the spinal column. It has to go all the way down to the bottom of the spinal column, where one of the meninges, the toughest one, the dura mater, attaches down down around the second sacral level. It attaches and fuses to the bone.
Okay.
But very often, oh, this poor guy's hurting here. But very often, what happens is when the rhythm is thrown off, that means we have to go to that area and restore it so that things can move and things can flow again.
Okay.
All right. And when it's restored, it feels really great. But we purposely induce a still point. It's sort of like when your computer has a problem, you shut it off.
Yep.
And then when you turn it back up, it reboots, it checks itself, and it hopefully corrects the problem.
Right.
That's what a still point does.
Okay.
So step number 1 and step number 10 at the very end are both still point induction.
Okay.
And once again, you just use 0 to 5 grams, whatever's appropriate for that person, and you just say, nope. We're just gonna help that rhythm relax for a minute, and you can stay there for seconds or minutes before it opens up and starts again.
So you begin and end with a still point.
Yeah, you do. So you shut down the system so it can reboot in the beginning, and then you shut down the system so it can maintain the corrections and be healthier. So when you do a still point, what you feel is that the flexion and extension close down, and you can feel things where the person says, oh wow, my hands and my feet are suddenly so warm, or they might break into a little sweat, and sometimes the therapist can feel a pulsing, and that's just the system checking itself. And very often the person can feel all these things too.
Really?
Yeah, and they know.
Because I was going to ask you if you can, like, you're sensitive to the feel of the energy, but can you actually feel the warmth coming off the person, probably?
Yes.
Okay.
And we feel the energy being released in the circumstances like, let's say you had an accident and you went from being a kinetic human being and flopping on the ground, and all of a sudden all that kinetic energy of falling translates into the impact. So it gets kind of stored, and sometimes tissues are deformed by way of strains or sprains, God forbid any fractures. But if you have all that, we call it energy, you have all that energy stored as a static situation, static energy. What we want to do is be able to get things to relax so the energy can express itself and you can go back. And so very often it's heat that's released. And some people say, well, that's just, now the blood flow is so much better, you get a lot more heat in the area. Well, that's valid too.
Good.
But yeah, you feel heat pouring into your hands when you do this sort of stuff, and you feel pulsing, the therapeutic pulse, lots of good stuff. Then we have something, step 2, we have something called the 5 diaphragms.
Okay.
Most of the connective tissue, particularly in the spinal column, but most of the connective tissue in the body, along the bones, the long bones, the legs and arms, runs longitudinally. It runs up and down.
Okay.
But then when you hit the torso, you have some connective tissues that by necessity have to be transverse to kind of hold you together. So in the lower part, the pelvic diaphragm, it's really kind of holding the pelvis. I mean, you have the ligaments, you have the fascia, you have tendons, you have muscles. Everything's kind of holding the fascia in place, which keeps all your viscera from going blip.
Yeah, really.
But you also have one here that's transverse, largely transverse in its orientation, and you have another one, which is your diaphragm, and it's largely transverse. It scoops up and into the ribs, and it helps support and work as a pumping mechanism for breathing.
Okay.
And you have the lungs and you have the heart. So you have one transverse diaphragm here, another one up through here with its connective tissues. Then up here, physical therapists call it the thoracic outlet,
Okay.
but you can also call it the thoracic inlet because things are going in and out in this area. It's a very busy area because you have blood vessels, you have nerves, everything's starting to concentrate and get up. Nerves particularly get up into the head. So you have 1, 2, 3, then you have another transverse layer at a bone called the hyoid. And the hyoid is a horseshoe-shaped bone right about here in the neck, and a lot of the muscles that go up and the tongue connect here. So that's transverse. And then the very last one, the last transverse area, is the base of the skull.
Wow. Okay.
Some of these muscles back here, the suboccipital, this is the occipital bone, the muscles under here can be 1.5 inches thick.
Really?
There are 13 suboccipital bones through here. So this is something that's very, very important to release, and that is the cranial base release that you see there. This is very important. We have to make sure that that stays very flexible.
Okay, because sometimes, like, if you go to a chiropractor and, you know, you're on your back and they're working on your skull or your arms or something, they'll say that the muscles are, like, really tightened up, and that's at the base of the skull. So
Oh yeah, and when you think about muscle, you know, we think about muscle. We think about the piece of beef on a plate.
Right.
But what people don't realize is that every single muscle cell, muscle fibril, has its own connective tissue. And then you get a clump of those together, and that is held.
Okay.
So it's like a box of spaghetti. And then if you took the box of spaghetti and wrapped that in saran wrap, then that would be the outer vesting layer of the muscle that becomes the tendon, which attaches to fascia. Half of the muscles in your body, roughly, attach to connective tissue, to fascia. And then, so they connect to either bone or fascia. But it's very important when you think about how dense it is up here. I mean, people think, well, it's just tight muscles, but each one of those cells has layer upon layer upon layer of fascia, connective tissue. So if the muscles are tight, that's tight too.
Okay.
And so that was a very good point.
Thanks.
And then the other treatments that we have down there, comprising 3, 4, 5, 6, 7, 8, and 9, those are different areas of the body that need to be sequentially released so that the rhythm can be full. So for instance, after we do the diaphragm release of these 5 here, then we would go on to releasing the sacrum. And the sacrum is absolutely crucial because it's the bottom of that connected system. And if the sacrum is jammed and tight, say you went sledding and you fell off and you jammed your sacrum, if that's tight down here, not much is going to be able to move up here.
Right.
I mean, it's a closed system that runs down. And as I said, the dura mater actually attaches to the second sacral level. So if this is locked down, you're not going to get anything to move and breathe as easily up here. So it's very important that we do this traction release and compression decompression at the sacrum. And some people, I mean, I've had people where I spend the first 3 or 4 treatments just releasing the sacrum because it can be just jammed in there. Yeah. Then we move up and we release the length of the tube. And I call this flossing the spine.
Okay.
Because, you know, when the dural tube is finally able to move along the length of the spine, it just seems to set the people free. So we have the dural tube rock, where you're just making sure that the sacrum and the occiput, which is this part right through here, is just the base of the skull. We're making sure they rock, because when you manufacture your cerebrospinal fluid, things have got to be able to open up. And then we make sure that things can glide. We make sure that the length of the tube can glide. And then we move on to the frontal lift. We actually work on the frontal bone. Let's say you're in a baseball game, you're the catcher, and a ball comes off and hits you. Yeah. This, of course, corresponds to the prefrontal lobes, you know, our higher thinking processes, all sorts of important stuff. And a lot of people, you know, and then there's some frontal sinuses and other areas in here that can be painful. So what we want to be able to do is make sure that this has its natural rhythm, so we listen there. And then we go to the parietal. And the parietal are the parts of the bones in the skull that look like a fence. So we make sure that they can move the way they're supposed to. And then we go to the temporal bones. And the temporal bones are, I don't like to label, but they're called the bad boys
And why?
because they have 3 different ways they can get stuck.
Oh, okay.
Plus, they interact with the jaw joint.
Okay.
So, if you've had a jaw injury, if you've had bad braces that just didn't work with you and stuff, that can affect the jaw joint.
Okay.
And then it can affect the whole temporal bone. Throw that off too.
So temporal mandibular joint that's where the saying comes from, is that area right there.
There it is, right there. Yep. So then we work on freeing up the sphenoid, and the sphenoid is this beautiful butterfly-shaped bone, and it's just tiny. This is all you can really see from the outside. This little tiny part here, and it goes in, and it helps form the crux. It interacts with the occipital bone, and it forms the crux of the pumping mechanism. So this has got to be free too.
Okay.
So we do that, then we make sure the jaw is released. You'll see here, then we move on to the jaw. Here's the sphenoid, and there we have to do all those 3 different ways for the temporal, and then we work on the TMJ joint.
Okay.
And all of these, keep in mind, these are very, very light pressures.
Okay.
Very light. In most people, it's around 5 grams, sometimes more. So people just feel like their bones are floating by the time we're done.
Really? Okay.
And then in craniosacral level 2, which is, then we also do a still point and wrap it up.
Okay.
But then on the second level of training, you actually get into the mouth because the bones that form the roof of the mouth are the base of the front of the skull.
Okay.
So sometimes with jaw injuries, fractured jaw or anything like that, those can be out of alignment and cause really uncomfortable headaches and pain. So that's our 10-step protocol, and that was what John Upledger came up with to help people who are not body workers help their clients.
Very good.
Yep.
Very good.
So, any other questions?
Now, like trigger points, what are some of the things that would cause? I see you have another, like a book with you. What are some of the trigger points? Trigger
points are a very interesting phenomenon. I think everybody intuitively knows that when they have a tight or sore muscle, like they've been gardening a lot, they kind of rub the area that hurts. As long as there's no frank dislocation or fracture, people just instantly go to an area that hurts, and they rub it, and they know it feels better.
Okay.
Well, back in the late 1950s and the early 1960s, Dr. Janet Travell from Great Britain discovered that if you applied pressure and you sustained it, and then you did a little bit of activity afterwards and maybe stretched it a little bit, the pain went away.
Okay.
And we didn't have sophisticated testing techniques back then to explain why it worked. She just knew it did. So back in the JFK administration, he had some serious back pain and back injuries. But you really can't be an effective president if you're getting morphine or you're getting prednisone and you're just not working at your top.
Right.
So he actually called Janet Travell in, and she stayed at the White House for a while.
Really?
And she helped alleviate his pain. She'd work on the tight muscles of the back, and then she said, "Okay, now go walk, do the rose garden, just walk, and then come back, and we'll see how you feel." And the other doctors, the traditional doctors, called her the voodoo queen or the voodoo because they couldn't figure out how it worked.
Yeah.
But now we know how it works.
Okay.
And
I was going to say, why don't you just bring it right over
Yeah.
here, and it'll be higher. And
now we know what a trigger point is, or we have some really good theories about what a trigger point is.
Okay, let me just move this stuff out of the way. Excuse me.
Okay. All right.
There, better?
Yes. Now I'm going to put this down so that the cameras can focus in on it. But what you'll see are these little spots in the muscles that they're referring to. And those are what we call the primary trigger points. And a trigger point tends to be where a main innervating nerve comes in and hovers over a muscle. They don't really touch the muscle, they kind of hover over the muscle. And they let out these wonderful chemicals that cause a muscle to contract. That's called the neuromuscular junction. And what they found out is that most trigger points occur in these areas. And after some sophisticated testing, we found out that a trigger point is really when certain channels in the muscle's membrane don't shut down. They stay open, they stay stuck open, so the muscle can never completely relax.
Wow, okay.
They're called calcium channels. So if the muscles stuck like this, and it really wants to be like this.
Right.
You can imagine how uncomfortable it gets to be over a period of time. It's like asking someone to hold a fist for a long time. If you held that fist for years, you wouldn't get blood circulating there well, you wouldn't get your lymphatics circulating well, and then the fascia would just shut down and get very tight. So when Janet Travell took a trigger point and pressed on it, she caused a minute ischemia, which means that she shut down some of the blood supply to the area, not much, just a little. And when she shut down that blood supply and then released the pressure, the calcium channels closed.
Really?
So the muscle spasm relaxed.
Oh, okay.
And then it usually takes 45 seconds or longer until you feel the muscles soften. And then what you do is you would do something to move the muscle, to get the blood pumping, to get the lymphatics flowing in there, and get the fascia starting to stretch a little bit. And it feels a lot better.
Wow. Okay.
Now, you can get trigger points. People ask me, do you get trigger points just because of accidents? You can get trigger points because of micro trauma or macro trauma. So micro trauma can be sitting in the same position at the computer for too long. Macro trauma is a car accident, fall down the stairs, slip and trip sort of a thing. Either one of those or a combination of both will cause trigger points.
Wow.
So people come to see me, some people come to see me once every 4 months. You know, if they've been gardening too much and they want their arms and their neck worked out and their lower back. Maybe the following season they've been skiing too much.
Okay.
And they want to have their quadriceps released. We'll do that. But there are some folks who have situations that don't go away. They might have chronic osteoarthritis, spinal stenosis, those sort of things. And in that situation, there's always a level of irritation and inflammation in an area, and the muscles and the fascia they're in that chronic state. They don't have a chance to relax. So I can correct the trigger points. The patient and I can figure out a home exercise program, but they end up coming back because the underlying irritation isn't removable.
Okay. Now, after you treat some of these trigger points, I mean, in the office, when you send the patient home, do you advise like heat or cold to the part or something like that?
Yep, we usually avoid putting heat on it.
Okay.
Unless there's someone who's just really phobic about cold. Like in
Okay.
the dead of winter, they can't. But we usually say an ice pack is excellent. Lots of water, and then the gentle stretching and gentle movement that I tell them to do, just to make them healthier. And after a craniosacral session, we know that craniosacral will last 3 to 4 days after I stop. So it's sort of like I've taken the key, I've put it in the ignition, I've turned the car on, and now it's going to the body's just going to take care of itself for another 3 to 4 days.
Okay.
So I tell them, for the next 3 or 4 days, your body's still evolving, it's still correcting, it's still healing itself, so be gentle, don't go. I had one gentleman who told me the story where he left a craniosacral session that was, he got in Albany, and had a flat tire on the way home. In the middle of a rainy, terrible, stormy night. Yeah. So he had to change the tire himself, and he ended up in the emergency room because his fascia was so relaxed and so lengthened that when he had to do all that digging around, he strained the muscles through here.
Wow.
So I advise people, if you can, call AAA.
Yeah.
but if you can, just take care of your body for the next 3 to 4 days, and just be kind to it.
Sure, sure. This is really, really fascinating. It's just, you just don't realize that all of this goes on, or like one simple thing can lead to all of these, how do I want to say, stoppages or obstructions within the body.
Yeah, and they could be minor, but they can be just enough, if there are enough of them, just to make you uncomfortable, not sleeping as well. And if you don't sleep as well, you don't heal. And if you don't heal, then it can become a cascading effect.
Right,
Yeah.
right.
But I always integrate trigger point in. I mean, I could be doing craniosacral, and even though we're doing a very gentle thing, if I sense that, say, some of the muscles on the side of the neck they're just become taut because there's so many trigger points in there. I'll just talk to the patient and say, okay, we're just going to do a little work on your neck now. We'll keep it very gentle. And one of the gentlest ways to do trigger points is to do the melt method. So melt,
which is?
it's just approaching the trigger points with a mild pressure and waiting for the muscle to invite you in.
Oh, okay.
When I went to my very first trigger point course, it was almost, well, it was extreme compared to melt, because I mean they really expected you to put as much force as the person can tolerate in there.
Really?
Yeah. And I really found that when you're exerting that much pressure on a sore spot in the body, that you don't get the effect you want because the people can't relax.
Right, right.
As much.
Because they're just like tightening up, wondering, okay, you're doing it to this part of me, and you know, if you find another really tight muscle or something, you're going to do it all over, you know?
Yeah.
Okay.
Just doesn't work out that well. So when I started learning the melt method, I was much happier with that. And something that's a little similar, kind of combining this with craniosacral and some of the zero balancing, is a method I use called simple contact. Barrett Dorco is a PT who has kind of put the package together. He calls it simple contact, but it's actually been known since the turn of the 19th to the 20th centuries as idiomotoric activity.
Okay.
And idio meaning just don't have a name for it, a motoric, motor.
Okay.
What it is it's an automatic subconscious response to a stressor in the body. So when people are releasing and unwinding in craniosacral, their body can start to move sometimes. It can really shift on the table. Sometimes it'll jerk because they're just releasing tension. And sometimes with zero balancing, you get that effect too. You know, people will shift. We call it shelving, where they put things back into place.
Okay.
And that is more or less idiomotoric activity, where the body senses an area of tension and it knows intuitively how to correct it, so it corrects it.
You know, sometimes when you're sleeping at night and you're just like in that period before you really doze off, some people, if you watch them while they're, you know, laying down or whatever, all of a sudden they'll jerk. It's like, is that the body going into relaxation, or?
Yeah, it is that, but it's a little hiccup along the way.
Okay.
And it's called a jerk. It's I believe, if I have it right, it's called a hypnic jerk, where you're just not quite down there, and then something in the central nervous system isn't ready, and it jerks you.
Really?
But then you can go back down. It's just a little hiccup along the way.
This is so fascinating. It's good.
Yeah, it is. It's really, really good. So idiomotoric activity is a way to unwind, unlock, unsnag the physical structures of the body. There are two main causes of pain in the body, and that's a chemical irritant or source, or a physical irritant or source of pain. And with idiomotoric, what you're doing is you're touching areas of the skin and cartilage and bone that allow increased sensation in the area, and you just let the body relax, and the body will start
Unwinding.
Yeah.
Because you were, the other day when we were talking, you were showing me sort of, you know, the motions that the body goes through, and it's fascinating too. So.
Yeah, typically if you watch a toddler having to sit still, which is against their nature, they are constantly moving and doing things because their central nervous system hasn't been taught to disregard tension yet. It's when they get to school or they get to other social functions and they start to override the impulse to undo tension and to stop twitching. When they're taught that, then they literally shut down idiomotoric activity. And so when people come to me and they start unwinding, they don't understand what they're doing. And then they're just actually just going back to their own natural corrective processes.
Very good. Well, we're sort of running out of time. Is there something you can just do, like to pull everything together? And we're definitely going to get you back again so we can continue this. But for your purpose today. Would you like to just summarize? And okay.
I think the one thing that would summarize this the most completely for me is something I learned in zero balancing.
Okay.
When you look at the energy systems of the body, the Chinese believe that there are 3 layers of energy. And the outer, most surface layer is the layer of energy that protects us as a barrier. It's very much like our lymphatic and immune system just under the skin, and it's there to prevent bad boys from coming in, like infection and stuff like that. So the Chinese believe very deeply in that outermost protective layer. That anything between that and your bones, your muscles, your arteries, your veins, your nerves, your organs, your fascia, particularly the fascia, is the energy system that stores your lifetime. Anything and everything that's happened to you in your lifetime, from developing in utero to the time you pass, they believe is stored in the flesh of the body. And then when you get down to the bone, the energy system in the bone, the one that zero balancing works on, craniosacral works on, that is your universal chi. That is your connection to eternity and healing.
Okay.
And when you correct that, when you get things lined up, everything
Comes in.
comes in.
Good.
Yeah.
Very good. Well, I'd like to thank you for being with us today, and hope you will come back. This has been phenomenal. I mean, so much information, and just mind-boggling. So, thank you again.
My pleasure.
Thank you. So stay tuned. We'll get Jody to come back and see us again, and I want to thank all of our viewers for being with us today, and we'll see you again. Bye now.